Well, to talk more about the COVID situation across the country, we're joined by Dr. Tinku Joseph, K, Chief of Interventional Pulmonology, Amrita Hospital. And thank you so much, Doctor, for joining us this morning. Right now in Kerala, the lockdown has been increased, and in 4 of the districts which are of which are seeing the maximum number of cases and a surge in cases, there's a triple lockdown that has been put in place there. Tell us more about what have you seen during this period of the lockdown? What sort of impact has it had?
Thank you. So ever since the lockdown has been imposed in Kerala, there has been a steady decrease in the number of cases, because prior to the lockdown we had close to 40 to 43,000 cases per day. And ever since the lockdown has imposed, there is a steady decline in the number of cases. And yesterday we had reported close to 29,000 cases. So the lockdown is working pretty well. And since today onwards, in 4 districts, we have imposed the triple lockdown policy as well. So hopefully the number of cases will be reduced drastically in another couple of weeks.
Right, sir. One of the concerns has been a lot of younger people getting affected by COVID and especially requiring, major medical intervention. And this was something we never saw in the first wave, though, of course, we still don't know whether this is in terms of just the absolute numbers, since the numbers are just so high, or whether it's percentages. But what has the experience been there? There's also been concern over the overuse of steroids and medication.
Okay, compared to the first wave, in the present second wave, what is happening is predominantly, I am one of the persons who is managing one of the ICUs in our Amrita Hospital. So in the first wave, it was predominantly the patients who were getting admitted to the ICUs was beyond 55, like 55 to 75 was the category. Those patients with the uncontrolled diabetes, then kidney disease, and the cancer patients were the people who were more prone for this illness. But the things are different in the present wave. The age group is different. People right from 20 to 40 are getting admitted. In my ICU, 80% of the patients are in this particular category. So the difference is the younger generation is affecting, and if you ask me the reason, the definitive reason would be that vaccine is working, and that's why the elderly are much more safer. The younger generation has not received vaccine. That's why in most of the ICUs across India, the age group between 20 to 45 are being more admitted.
Right. One of the problems also is, I think, self-medication, because there are many reports of, people just sharing their prescriptions. And, if here we have a situation in which whole families are affected. So one prescription is being used for everyone, and that one-size-fits-all does not really work in terms of treating COVID. Dr. Joseph, also, if you could tell us, a big concern in various states in the north is of the black fungus mucormycosis that is being reported. What is the situation in Kerala? Have you had such cases?
Okay. So far, the number of cases reported in Kerala is less than 10. We don't have a significant spread of the disease compared to Delhi, Gujarat, and Maharashtra, where it was reported initially. One of the main reasons for the increase, this zygomycetes or mucormycosis, it's one of the rare fungal infections, if you ask me. And previously, most of the doctors used to might have seen maybe 1 or 2 cases in a month, and now that was predominantly seen in people who are suffering from uncontrolled diabetes mellitus, who are on insulin therapy, as well as in patients who are suffering from cancer and who have undergone any organ transplantation, like the solid organ, as well as the bone marrow transplantation, as well as the HIV patients. So these are the category of people who are prone to develop mucormycosis infection. Now let's see what is different in COVID-19. So the COVID-19 patients, unfortunately in India, the present scenario is that let it be mild, moderate, or severe, almost everyone is on steroids. So that has to be stopped. The patients who require steroid are the ones who are suffering from moderate to severe illness. So the guidelines has to be followed. Each and every patient, there is no indication to be on steroids. So now let's see what is happening. The patients who are on steroids, naturally their blood sugar level goes up, and unfortunately the blood sugar level is not monitored in most of the places, because it is extremely difficult due to the huge load of patients, and naturally the hyperglycemia or the increased blood sugar level acts as a culture media for the virus, for the fungus to grow in. So that's how it is happening. And yeah.
Right, and so this is something that really needs to be watched out for in those patients of concern post-recovering from COVID, because it's tragic to recover from COVID and then get affected by a case like this. Thank you so much, doctors, for taking time out and joining us on the channel this morning.